All right, I don't think anyone is going to like this headline. The U.S. is experiencing a nationwide summer bump in newly confirmed COVID cases. The CDC reports more than 16% of tests came back positive for the week of July 27th. That's a 2% increase from the previous week. And as the number of positive cases climb, there are renewed questions about how well at-home tests are working and what should be done if they have expired. So for more on that, let's bring in Professor of Preventive Medicine, Health Policy, and Infectious Diseases at Vanderbilt University, Dr. William Schaffner. Dr. Schaffner, good to see you. I haven't seen you in some time since the old days. Why is this new variant of COVID causing such an uptick in new cases? And do symptoms with this latest strain present differently from previous ones?
Well, Tom, what's happening is these variants of the Omicron family, they're now the children and grandchildren of Omicron, are very, very contagious. So they're spreading very readily. Of course, we're helping that spread because we're traveling, going about our business. We're not social distancing anymore. And so there are lots of mild cases. And then on occasion, these viruses find someone who's older, frail, immune compromised, not up to date with their vaccines, and that's causing a spike in hospitalizations. So that's what's happening across the country. We always get a summer bump. This is a considerable bump. Then it goes down, and then we get that big increase again in the winter.
Obviously, the timing of this is not ideal. Kids are already going back to school this month, but companies like Novavax are already cutting forecasts in anticipation of lower COVID vaccine sales, revenue forecasts, I should say. What's your advice to parents headed into the fall? Should everyone be getting vaccinated or just those considered at higher risk?
Well, when we get the updated vaccine this fall, and it should be coming along pretty soon, probably by September, the recommendations are already out there. They're similar to what happened last year. If you're 6 months of age and older in the United States, take advantage of this vaccine. Last fall, we under-vaccinated people. Lots of people didn't come in for their vaccine. We're concerned that will happen again this year. So we're really out letting people know that this vaccine will be available, and it's the single best thing that you can do to help prevent disease. I put a special emphasis on people who are older, frail, have underlying chronic conditions, are immune compromised, and who are pregnant. Those are the folks we're especially concerned about.
Yeah, certainly important to keep in mind. During the height of the pandemic, as you'll remember, schools, business, and government organizations were offering all these free tests, all the free tests you could want, really. A couple years later, those tests are collecting dust in a lot of people's closets. They may be past the expiration date. Should we be throwing those tests out, or are they still good for us to use if we think we might have symptoms?
You know, these tests really have a longer lifespan than is indicated on the box in which they come. But I'm a little bit worried about how people have stored them. Some of them have gotten very, very hot, for example, and that could reduce their sensitivity. Better to use a test that's not expired in order for you to have confidence in the results. The last thing you want is to have COVID and have the test turn out negative, and then you'll spread it to other people. You don't want that.
So if you're able to get new tests, if you're able to get the vaccine, protect yourself. Dr. Schaffner, some valuable advice there. Thank you for your time.
My pleasure.